Well, good morning, good afternoon, and good evening from wherever you are calling in from the world. My name is Bill Taranto, and as I said, I'm president of the Merck Global Health Innovation Fund. And we've been really proud sponsors of HIT Lab's Women in Health Tech program that happens every spring, as well as Prem Timkazit on my staff has been a judge at the Women's Health Tech Challenge also for the last number of years. So we're really proud that we support women's health. And as a father of two daughters, I'm pleased to be the first speaker on this day dedicated to a broad discussion about women's health and femtech. As all of you know, there's an enormous opportunity in this market space, and a number of professionals here who have so many different perspectives to share will validate that point. And I know it's going to be a very informative day around women's health. And I'd like to get into a little bit about the agenda and what's going to be covered today and some trends. That's just the Merck legal notice that anything I say today is my opinion and not necessarily reflective of Merck. So when we look at today's agenda, what is femtech or women's health? In 2023, often the terms are used synonymously. It refers to the initiatives made by the industry participants and researchers that include technical solutions such as mobile apps, software, wearables, and diagnostic tools that improve wellness for all females. Looking more specifically at what will be covered today, the topics include women's mental health, health equity, value-based care, digital health, just to name a few of the subjects that will be covered. And it's actually really wonderful to see a number of women leaders today speaking from Lilly, Samsung, Kroger, and other companies including Medidata, Novo Nordisk, and Mend. What's impressive to me about the focus on women's health is to realize that in the early 20th century, women's health was very narrowly and primarily equated with maternal health and the role of women as mothers. With the birth control movement starting in 1916, the definition of women's health began to include issues of reproductive health and birth control over the spacing for and timing of childbirth. But by the 1960s and 70s, reproductive health issues were at the center of the new wave of women's health. By the late decade in the early century, the definition of women's health had to extend to include many other things like social, legal, medical, and economic issues. In 2016, the term femtech was first coined by entrepreneur Ida Tin, and it encompasses a range of technologies that enable consumer-centric products and solutions for women's health. Ida Tin is a Danish entrepreneur and author who co-founded and CEO of the women's menstruation tracking device called Clue. Today, the category involves, as I said, mental health, clinical development, value-based care, and numerous other areas that we'll be focusing on. With the rise of the she economy, women are playing an increasing role across healthcare and consumers, decision makers, and healthcare professionals. Women are over half the population, make 80% of the healthcare buying decisions, and spend 29% more on healthcare than men do. So how is it just 4% of all healthcare R&D focuses on women's health? It's not good, but it's changing. This is a female-powered economy, and it's more than a mega trend for leveraging the economy. It's a massive force that addresses the inequalities women have faced at the home, in society, and at their workplaces for generations. That's why investors like myself are paying attention. The area has increased significantly over the years in both popularity and size and continues to prosper. The U.S. market today is approximately $3 billion, and it's forecast to grow at a CAGR of 20.3%. By 2027, it's predicted to be $6 billion in U.S. dollars alone. The reason there's an increasing demand in femtech, today everyone's normalizing the conversation around formerly taboo topics of women's health and promoting women's sense of self-worth. Numerous products and innovations and partnerships are occurring and often lead to wider opportunities for women in this space. The Starters Insights graphic reveals that the impact of the top 10 femtech trends in 2023. Startups are developing solutions to facilitate maternal care as well as to tackle prenatal and postpartum issues. While the wearables healthcare interventions, simply like menopause symptoms management and innovative skincare products, remain a top trend in the industry, other things are starting to change. We see further fertility automation solutions, including pregnancy monitoring, menstruation tracking, and infertility procedures are all gaining interest. AI and virtual assistants in sexual health products help reduce the stigma associated with women's health and encourage more women to seek help. Similarly, the precision oncology tools for early detection of women's cancers improve health outcomes for everybody. Startups are developing solutions directly targeting period pain management and pelvic and uterine care to cater to large women populations. Lastly, novel tech solutions advance women's safety and ensure a safer environment for women in society through the real-time monitoring and threat response. Over the last century, over the last couple of years, there's been a rise in the femtech industry, as I've discussed, new companies, new initiatives, and last but not least, more research. I'm personally excited to see these innovations and new investments. Moving forward, we need to focus awareness on getting the word out about femtech and what's happening. Conferences like this one are really helping bring the attention to really what matters. Additionally, we need more women in leadership, science, technology, and entrepreneurship roles. Thank you all for coming today, and we're really looking for a really exciting day and learning more about what is happening in women's tech or femtech and where the opportunities lie. Thank you and enjoy the day.